Hello, health champions, and welcome. Autism spectrum disorder is a complex neurodevelopmental condition that affects communication, social behavior, and patterns of interest or activity. But beyond the core features most people recognize, there's a deeper emotional world experienced by many autistic individuals, one marked not just by difference, but by silence. Not the silence of not speaking, but of not knowing how to name what is felt. This internal difficulty often comes in the form of alexithymia, a trait where people struggle to identify and express their emotions. It is not unique to autism, but it is significantly more common in autistic individuals, and its presence can shape every emotional and social experience that follows. People with alexithymia often experience emotions physically, tension, heat, or a racing heart, but lack the words or mental clarity to translate those sensations into feelings like anger, sadness, or excitement. This disconnect can create immense frustration and confusion. Imagine feeling something deeply, but having no map or language to navigate it. Now place that experience inside a world that expects emotional transparency, empathy, and verbal explanation. The result is often miscommunication, emotional isolation, and in many cases, psychological distress. This emotional difficulty is one of the hidden drivers behind the high rates of depression in the autistic population. It's not simply the social isolation or the sensory overload that causes pain, although those certainly contribute. It's also the inability to regulate emotions because one can't even identify what those emotions are. Depression in autistic individuals often starts early and remains persistent, sometimes in the form of dysthymia, a chronic low-grade depressive state that doesn't necessarily incapacitate, but gradually erodes joy, energy, and motivation. People experiencing dysthymia may go through years of feeling numb, blank, or simply worn down, never reaching the extreme lows of major depression, but also never finding relief. Closely tied to these experiences is anhedonia, a condition where the ability to feel pleasure, either in anticipation or in the moment, is diminished or lost. For someone already dealing with alexithymia, the combination can be devastating. When you can't identify your emotions and you don't feel pleasure from activities or social engagement, life can begin to feel like an endless list of tasks performed without reward. This isn't laziness or disinterest. It's a neurological state where the brain's reward systems fail to activate, even during experiences that are supposed to be fulfilling. That absence of joy is often invisible to others, but deeply impactful for those living it. Many individuals on the autism spectrum describe how their emotional pain is minimized or misinterpreted by others. Clinicians, teachers, and even family members sometimes view emotional flatness or withdrawal as just another part of being autistic. This assumption, while often unintentional, leads to what's known as diagnostic overshadowing. Real mental health concerns like depression, chronic anxiety, or suicidal thoughts are overlooked because they are seen as part of the autism diagnosis. As a result, people go undiagnosed and untreated, carrying invisible burdens for years. Even more troubling is that these emotional difficulties often become intertwined. An individual with alexithymia may struggle to understand why they feel chronically empty, which is characteristic of dysthymia. At the same time, their lack of emotional clarity can prevent them from recognizing the absence of pleasure, a key marker of anhedonia. These conditions don't sit neatly in boxes. They blend, compound, and reinforce each other. What begins as a subtle emotional disconnection can spiral into complete psychological shutdown, especially when there's no language, recognition, or support. Science is gradually catching up to these complexities. Studies of brain function have shown that areas involved in emotional awareness and reward processing are differently wired in people with alexithymia and anhedonia. Regions like the insula, anterior cingulate cortex, and parts of the limbic system show reduced activity or altered connectivity, which supports what many individuals describe subjectively. They feel less, and what they do feel is often unclear or overwhelming. This neurological reality demands a therapeutic approach that goes beyond traditional talk therapy, which assumes people can articulate their emotions from the start. Promising therapies are beginning to emerge. Approaches that focus on building emotional awareness rather than just treating surface-level symptoms have shown positive results. These include mentalization-based therapy, which helps people understand how thoughts and feelings relate to behavior, as well as mindfulness and interoception training, which helps reconnect bodily sensations with emotional understanding. For those experiencing anhedonia, behavioral activation strategies, which involve structured engagement in rewarding activities, can sometimes reawaken the brain's pleasure circuits, especially when combined with emotional awareness work. But before any therapy can be effective, the emotional experiences of autistic individuals must be acknowledged for what they are: valid, serious, and often overwhelming. Emotional difficulties like Alexithymia, Anhedonia, and Dysthymia are not side issues or minor concerns. They are central to the lived experience of many autistic people. When left unrecognized, they lead to isolation, misdiagnosis, and suffering. When seen clearly, they open the door to healing, connection, and agency. There is no single path to emotional understanding for someone with autism, but the journey begins with permission to feel what's felt, to not know what it is, and to still be supported anyway. This is not just about autism. It's about the universal human need to be understood, even when words are hard to find. Emotional silence is not the absence of emotion. It is a language waiting to be heard. For many individuals on the autism spectrum, the struggle with emotional experience doesn't exist in isolation. It is entangled with a lifetime of being misunderstood. When a child repeatedly fails to express joy or sadness in the expected way, adults around them may interpret this as indifference or defiance. In truth, what often lies beneath is not a lack of feeling, but an inability to connect inner sensations with outward expression. The child feels something but cannot name it, shape it, or communicate it. Over time, this can lead to a deep sense of alienation, not only from others, but from oneself. This alienation often grows during adolescence, a time when identity formation and social belonging become central. For autistic adolescents with Alexithymia and Anhedonia, the pressures of fitting in and maintaining emotional conversations can become overwhelming. They may withdraw not out of choice, but because social interaction becomes cognitively and emotionally exhausting. They are expected to express enthusiasm, intimacy, and empathy, while internally struggling just to understand whether what they're feeling is sadness or fatigue. The emotional disconnection, already present, becomes reinforced by social failure, rejection, or ridicule. Each painful interaction confirms the belief that they are fundamentally different. These internal battles rarely occur in plain sight. Outwardly, the person might appear calm, aloof, or even unemotional. Inwardly, however, there may be intense anxiety, shame, or despair. Depression, especially in the form of dysthymia, often masks itself behind these emotional differences. A person might go years without being diagnosed because their symptoms are subtle. Chronic tiredness, lack of enthusiasm, social apathy, and a vague but persistent sense of emptiness. These are not always recognized as signs of depression, especially when they are mistakenly attributed to the autism diagnosis. The risk, of course, is not just academic. The emotional pain resulting from untreated dysthymia or anhedonia can escalate into severe depression or even suicidal ideation. And yet, suicide risk among autistic individuals, particularly those without intellectual disability, is often under-discussed. Research has shown that autistic adults are significantly more likely to die by suicide compared to the general population. This risk is heightened further in those who experience alexithymia, because when one cannot name or process emotional pain, it becomes that much harder to seek help, explain suffering, or plan recovery. This points to a fundamental need: recognition. Emotional distress in autism does not always follow the rules clinicians are trained to look for. A flat tone of voice, a lack of tears, or a passive demeanor may all mask significant suffering. In fact, many autistic individuals learn to camouflage their emotional struggles, mimicking social behaviors or expressions without internal connection. This masking, while it may protect them from immediate judgment or exclusion, carries a heavy psychological cost. Studies have shown that constant masking leads to increased rates of burnout, anxiety, and depression. Despite these challenges, it's important to note that emotional growth is entirely possible. The brain, while shaped by neurology, is also shaped by experience. With support and the right tools, many autistic individuals develop greater emotional insight over time. Emotional literacy, learning to identify, describe, and respond to internal states, is not a fixed trait but a teachable skill. Even for those who begin with severe alexithymia, gradual practice with body scans, emotion charts, and reflective journaling can create meaningful shifts. These may seem like small steps, but in the long term, they build the scaffolding for emotional awareness and resilience. Therapeutic support, too, must adapt. Many traditional talk therapies rely on the assumption that the client can articulate what they feel. For someone with alexithymia, this can lead to early dropout or feelings of failure. Instead, therapy should begin with sensory and interoceptive experiences, what the body is doing, not what the person thinks they should be feeling. From there, meaning can be slowly built. When done consistently and with patience, this method creates a bridge between physical sensation and emotional understanding. It teaches the person that their feelings, though hard to name, are real and worthy of attention. Another helpful approach comes through structured behavioral routines aimed at increasing access to pleasure. In cases of anhedonia, individuals may stop pursuing even previously enjoyable activities because the reward no longer registers. Behavioral activation helps reverse this pattern by gently reintroducing meaningful tasks, not based on feeling motivated, but based on a structured plan. Over time, this repeated exposure can rewire reward pathways and rekindle emotional engagement. While it is not a quick fix, the cumulative effect can be life-changing. For some, medication may play a role, particularly when depression is severe or disabling. However, pharmacological treatment must be carefully considered. Autistic individuals often have heightened sensitivity to medications and may respond differently than neurotypical patients. Antidepressants, while potentially helpful, must be paired with therapeutic support that addresses emotional awareness and cognitive rigidity. Medication can lift the weight of depression, but it cannot teach someone how to understand what joy feels like or how to name what hurts. What remains essential throughout is the presence of empathy. For families, teachers, therapists, and peers, the most powerful tool is often the simplest one: the willingness to believe someone when they say they are struggling, even if that struggle is invisible. For the person experiencing alexithymia or anhedonia, validation can be transformative. It offers a counter-narrative to years of being told they are too sensitive, too dramatic, or not feeling anything at all. It affirms that their experience matters, even when it's hard to explain. In relationships, this kind of validation can mean the difference between connection and rupture. Romantic partners, friends, and caregivers often misinterpret emotional distance as rejection, but understanding the difference between detachment and inability opens space for patience and connection. It helps shift the question from, "Why don't you care?" to "How can I help you feel safe enough to share?" This change in framing can reduce conflict and build trust, even when emotional expression remains challenging. It's also important to remember that autistic individuals with alexithymia or dysthymia do not lack emotional depth. Quite the opposite. Many feel things intensely, but are simply unable to organize or express those feelings in conventional ways. Their silence should never be mistaken for indifference. Emotional experience, like communication, exists in many forms. Some of it is spoken, some of it is behavioral, some of it exists quietly beneath the surface, waiting for the right moment or method to emerge. These invisible struggles may never fully disappear, but they can become less suffocating, less defining, and less misunderstood. When we make room for the emotional experiences of autistic individuals, not by demanding they express themselves in neurotypical ways, but by meeting them where they are, we offer something profoundly healing. We offer a space where feeling uncertain or blank or disconnected doesn't have to mean feeling broken. In the journey of emotional understanding within autism, one key realization begins to emerge. Growth is not about becoming more normal, but about becoming more connected to oneself. For individuals navigating alexithymia, the process of naming emotions is not just linguistic, it is existential. It is about finding out what it means to feel alive. The first time someone recognizes, "I'm not angry, I'm scared," or "this pressure in my chest is sadness, not indigestion," it can be a revelation. These moments of clarity may be fleeting at first, but they accumulate, slowly transforming confusion into self-awareness. And that self-awareness often has ripple effects across every part of life. In school settings, children with alexithymia and anhedonia may appear disengaged or inattentive. But when teachers understand that these behaviors might reflect emotional or sensory challenges, the classroom becomes a more inclusive environment. A child who's withdrawn might not need punishment or redirection. They might need help connecting with what they're feeling inside. This could be facilitated by simple practices like emotion check-ins using color codes or body maps, or even just having a quiet, predictable space to retreat when overwhelmed. These tools are not cures, but invitations for the child to re-enter the world of feeling, one step at a time. In the home, parents often wrestle with fear and uncertainty. They want to connect with their autistic child, but find themselves faced with silence, confusion, or emotional outbursts they can't explain. The fear that their child might be in pain and that they are powerless to reach them can be devastating. But education is powerful. When parents learn that alexithymia is a neurological trait and not an emotional failure, their approach can shift from frustration to curiosity. Instead of asking, "What's wrong with you?" they might ask, "What are you sensing right now?" Or, "Do you want to draw it instead of saying it?" These small shifts in communication can reduce shame and build bridges that words alone sometimes cannot. As autistic individuals grow into adulthood, emotional challenges evolve. The pressures of independence, relationships, employment, and identity intersect with emotional regulation in complex ways. A young adult who struggles to feel excitement or pleasure might find it hard to pursue goals or maintain relationships. An employee who cannot identify stress until it becomes burnout may cycle through jobs, unsure why the fatigue never lifts. These patterns are often misread by others as laziness or lack of drive, but in reality they stem from deeper neurocognitive differences in how emotion, motivation, and reward are processed. This is why workplace accommodations are not just about sensory needs, but also emotional ones. Autistic adults benefit from environments where expectations are clearly stated, emotional labor is minimized, and routines are respected. But beyond these structural supports, what matters most is relational safety, the assurance that emotional challenges will not be pathologized or punished. When supervisors and co-workers are trained to recognize the signs of burnout, shutdown, or emotional masking, the workplace becomes not just more equitable, but more humane. Mental health professionals, too, must continue adapting. Traditional psychotherapy often fails autistic clients because it assumes a linear relationship between thoughts, feelings, and behavior. But for someone with alexithymia, the ability to access and describe feelings may come much later, after the body has been calmed, trust has been built, and alternative forms of expression have been introduced. Therapists who approach emotional silence with patience and creativity, offering drawing, movement, metaphor, or sensory tools, tend to build stronger therapeutic alliances and more meaningful outcomes. In some cases, group therapy or peer-led support groups can provide powerful healing. In groups where autistic individuals share experiences without the pressure to conform to neurotypical emotional norms, a sense of belonging can emerge. Hearing someone else say, "I don't know what I feel most of the time either," can be grounding and relieving. It breaks the illusion that emotional confusion is a personal failure. It becomes clear that it is a shared trait, common, explainable, and addressable. These groups often create space for authenticity without the burden of constant self-translation. For those living with dysthymia, the goal is not always to feel joy, but to feel something real. Even faint sparks of satisfaction or calm can mark progress. A walk that brings a flicker of interest, a conversation that doesn't drain energy, a moment of silence that feels like rest instead of despair. These are milestones. Progress is rarely dramatic. It is often quiet, slow, and deeply internal. But it is no less valuable. It is the slow return of color to a life that once felt grayscale. It's important to remember that the co-occurrence of autism, alexithymia, anhedonia, and dysthymia is not a failure of character, nor a flaw of identity. It is a reflection of how complex human neurology can be. Some people are born with brains that process emotions through different channels. Some feel first in the body, then in the mind. Some lose their sense of joy temporarily or chronically, not because they have given up, but because the chemistry of pleasure itself has changed. Understanding these realities doesn't diminish the pain, they are still hard, but it gives that pain context, and in that context, a path forward. Hope does not always look like happiness. Sometimes it looks like stability, like being able to say, "I didn't cry today, but I also didn't feel like I was drowning." Sometimes it looks like better sleep or fewer arguments, or the ability to send a message instead of disappearing. These small changes are real. They mark movement, and movement is a form of healing. Society as a whole must begin to expand its definitions of emotional health. We must stop assuming that those who can express emotion are unfeeling, or that those who don't smile are joyless. The human emotional spectrum is wide, And autism reminds us that not all emotions fit the expected mold. There is value in silence, in neutrality, in emotional experiences that don't come with a name but are felt nonetheless. The future of emotional support for autistic individuals lies in this expanded understanding. It lies in the recognition that emotional growth is not about fixing people, but about equipping them. Teaching emotional literacy, providing sensory and interoceptive tools, and offering support without judgment. These are the interventions that matter. And above all, listening. Listening not just to words, but to patterns, to behavior, to silence, and to what emerges when someone finally feels safe enough to say, "I think I'm feeling something. I don't know what, but I think it matters." The journey toward emotional empowerment within the autistic experience is not a straight path. It is winding, cyclical, and deeply personal. Many individuals find themselves returning to the same emotional questions throughout their lives. Why do I feel so numb? Why do I shut down when others expect me to open up? What's wrong with me if I can't feel joy the way others do? But in time, with support and self-education, these questions can transform. They can shift from expressions of self-doubt to deeper inquiries rooted in self-acceptance. What do I need to feel safe in my emotions? What does joy look like for me, not for others? How can I build a life that honors how I feel, even if I can't always name it? These shifts do not happen in isolation. They are cultivated in relationships, with friends, partners, therapists, peers, and communities that accept neurodivergent emotional experiences as legitimate and valuable. The importance of community cannot be overstated. For autistic individuals, especially those living with alexithymia and chronic emotional dullness, being surrounded by others who understand the quiet weight of these challenges can create a deep and stabilizing sense of belonging. Autistic-led spaces, online forums, advocacy groups, and creative collectives have become some of the most powerful platforms for emotional exploration. Within these communities, people share not just their pain, but their strategies. They discuss the tools that work for them: emotion wheels, sensory breaks, coded communication systems, therapy that feels validating, or even just the act of sitting in silence with another person who gets it. These acts of solidarity become more than coping mechanisms. They are forms of resistance against a world that too often tells autistic people their feelings are broken. It's worth emphasizing that emotion, for many autistic people, is not absent. It is differently sequenced. Some feel a tidal wave of emotion with no warning, only realizing later what that feeling was. Others feel nothing in the moment but process events days, weeks, or even months later. This delayed emotional response is frequently misunderstood as apathy or coldness, but it is neither. It is simply a different rhythm of emotional processing, one that requires patience both from the individual and those around them. Another overlooked factor in emotional experience is sensory processing. Many autistic individuals are hyper or hyposensitive to sensory stimuli, and this can influence emotional states in subtle yet powerful ways. A bright room, a scratchy fabric, or an unpredictable noise might create a constant background of stress, which makes emotional regulation harder. Conversely, a calming texture, soft lighting, or a familiar sound can facilitate emotional openness. These environmental factors are not just preferences. They are tools that can either support or hinder emotional well-being. Sleep, nutrition, and physical health also intersect with these emotional challenges. Sleep disturbances are common among autistic individuals and often exacerbate symptoms of depression, emotional flatness, and stress sensitivity. Nutritional imbalances, sometimes stemming from sensory-based food restrictions, can further impact mood and energy levels. This means that improving emotional health often requires a holistic approach that includes not just therapy and communication strategies, but also basic physiological care. Treating the body with consistency and kindness becomes an emotional intervention in itself. For some, creative expression becomes the first language of emotion. Art, music, movement, and storytelling allow autistic individuals to explore feelings they cannot yet put into words. These creative outlets bypass the need for traditional emotional vocabulary and instead tap into something deeper, more embodied. A drawing might say what a sentence cannot. A melody might reflect joy or despair in ways that are far more accurate than words ever could. Encouraging and supporting these forms of expression can unlock profound emotional insight, especially for those who have spent years in silence. There is also power in ritual and routine. While these are often framed as rigidity in autism, they can serve an emotional purpose. Repetition provides safety. Structure gives predictability in a world that feels chaotic. For those who struggle with emotional turbulence, routine can create space for regulation. A morning walk, the same cup of tea, a fixed bedtime playlist. These rituals become anchors, offering subtle but crucial grounding in the midst of emotional ambiguity. In intimate relationships, emotional challenges often play out most painfully. A partner may misinterpret alexithymia as disinterest or unavailability. They might ask for vulnerability and feel rejected when none is offered in the expected way. Here, education becomes an act of love. When both people understand that the absence of emotional language is not the absence of emotional connection, new forms of closeness become possible. A touch, a gesture, or a shared quiet moment can become expressions of intimacy as meaningful as any declaration. Romantic partners of autistic individuals, especially those with alexithymia or anhedonia, benefit from learning to attune to nonverbal cues, to respect periods of emotional downtime, and to honor emotional expressions that emerge outside of conventional expectations. And for autistic individuals themselves, learning to recognize how they express care, whether through actions, routines, or simply presence, can be empowering. They learn that love does not always need to be loud. It can be consistent, quiet, and deeply sincere. Self-love, too, is a process that must be reframed. For someone who lives with emotional numbness or chronic melancholy, self-love might not feel like joy or celebration. It might look like self-permission. Permission to not perform emotions, permission to rest, permission to feel flat without guilt. It might mean showing up for oneself through structure, honesty, or asking for help even when the words feel clumsy. This kind of love is not flashy, but it is steady, and it builds a life that feels safer and more sustainable over time. Parents of autistic children, particularly those showing signs of alexithymia or dysthymia, often ask, "Will my child ever be happy?" It's a heartbreaking question rooted in deep care, but it's also shaped by societal expectations of what happiness should look like. The answer is not found in smiles or enthusiastic social interaction. It's found in moments of calm, of comfort, of self-knowing. An autistic child may not express joy the way others do, but they can experience contentment, fascination, and connection in ways that are no less rich. Learning to recognize and support those moments, even when they don't match the neurotypical template, is one of the greatest gifts a parent can offer. In adulthood, autonomy becomes a vital part of emotional well-being. The ability to make choices that align with one's sensory needs, social limits, and communication preferences builds confidence and reduces distress. When autistic adults are trusted to know what works for them, even if it looks unconventional, they are more likely to thrive emotionally. Whether it's choosing to work remotely, limiting social interaction, or building a life centered around solitary passion projects, these decisions are not avoidance. They are forms of emotional self-preservation and self-expression. The world is slowly beginning to catch up. As neurodiversity awareness spreads, we are seeing more inclusive practices in schools, clinics, and workplaces. But inclusion must go deeper than accommodations. It must include emotional inclusion, the recognition that not everyone will express, process, or understand emotions in the same way. We must normalize emotional differences, not pathologize them. We must move from fixing to supporting, from diagnosing to listening, from pity to empowerment. Because at the heart of every struggle with alexithymia, anhedonia, or dysthymia is a desire to connect, to be known, to feel safe. These desires may be expressed in unfamiliar ways, or they may hide beneath years of masking. But they are there, always. And when we approach them with respect, patience, and humility, we begin to create a world where emotional silence is not feared, but honored. A world where different emotional rhythms are not just tolerated, but celebrated. A world where being autistic is not about being less emotional, but about feeling, understanding, and expressing in a way that is deeply, authentically human. And so, as we move toward the conclusion of this journey through autism, alexithymia, anhedonia, and dysthymia, we must remember the immense diversity that exists within the autistic community itself. No two individuals experience these challenges in exactly the same way. Some may live with intense sensory and emotional experiences that overwhelm them daily. Others may navigate the world with a steady, flat affect that hides a complex inner life. Some may speak openly about their struggles, while others communicate through art, movement, or simply silence. All are valid. All are deserving of recognition, care, and dignity. Understanding the neurological underpinnings of these emotional differences allows us to extend compassion not only to others, but to ourselves. Neuroscience shows us that the autistic brain often processes stimuli and emotions differently, not incorrectly. Research suggests differences in interoceptive awareness, in limbic system activation, and in reward circuitry, all of which can contribute to the experience of Alexithymia and Anhedonia. These are not failures of the individual, but natural variations in human neurobiology. They invite us to rethink the standards we use to define emotional health. No two individuals experience these challenges in exactly the same way. Some may live with intense sensory and emotional experiences that overwhelm them daily. Others may navigate the world with a steady, flat affect that hides a complex inner life. Some may speak openly about their struggles, while others communicate through art, movement, or simply silence. All are valid. All are deserving of recognition, care, and dignity. Understanding the neurological underpinnings of these emotional differences allows us to extend compassion, not only to others, but to ourselves. Neuroscience shows us that the autistic brain often processes stimuli and emotions differently, not incorrectly. Research suggests differences in interoceptive awareness, in limbic system activation, and in reward circuitry, all of which can contribute to the experience of alexithymia and anhedonia. These are not failures of the individual, but natural variations in human neurobiology. They invite us to rethink the standards we use to define emotional health. And yet, we must also hold space for the real pain that comes with these conditions. Living with dysthymia, for instance, can feel like walking through life with a fog that never fully lifts. People with dysthymia are often highly functional, going to school, work, raising families, yet they do so with a weight on their shoulders that others may not see. Because their symptoms are chronic but mild, they're frequently dismissed or misunderstood. But emotional pain that lingers quietly can be just as debilitating as more acute mental health crises. It deserves attention, and more importantly, it deserves compassion. When dysthymia overlaps with autism, the result can be a unique emotional landscape. One where the drive for stability clashes with the undercurrent of persistent low mood. Individuals in this intersection may become experts at masking, performing cheerfulness or neutrality to avoid scrutiny. But behind closed doors, many feel empty, disconnected from joy, and fearful that their emotional world is somehow broken beyond repair. It's in these quiet corners that we must extend the most gentle understanding. People with dysthymia are often highly functional, going to school, work, raising families. Yet, they do so with a weight on their shoulders that others may not see. Because their symptoms are chronic but mild, they're frequently dismissed or misunderstood. But emotional pain that lingers quietly can be just as debilitating as more acute mental health crises. It deserves attention, and more importantly, it deserves compassion. When dysthymia overlaps with autism, the result can be a unique emotional landscape. One where the drive for stability clashes with the undercurrent of persistent low mood. Individuals in this intersection may become experts at masking, performing cheerfulness or neutrality to avoid scrutiny. But behind closed doors, many feel empty, disconnected from joy, and fearful that their emotional world is somehow broken beyond repair. It's in these quiet corners that we must extend the most gentle understanding. Recovery for many is not a destination. It is an ongoing process, a series of choices, small, often invisible, that gradually build toward emotional clarity and well-being. It's choosing to eat even when appetite is gone. It's getting out of bed on days when the numbness is thick. It's reaching out to a friend even if the words feel mechanical. Each of these acts is a kind of resistance, a refusal to let emotional disconnection define one's life. The concept of emotional fluency, particularly for those with alexithymia, can be learned over time. Like any language, it requires practice. One might begin with a simple daily check-in. Where in my body do I feel tension? What color is my mood today? These exercises might seem small or silly, but they rewire the brain slowly. They help reconnect physical sensation with emotional labeling. And over time, they build a bridge from internal chaos to external expression. It's choosing to eat, even when appetite is gone. It's getting out of bed on days when the numbness is thick. It's reaching out to a friend, even if the words feel mechanical. Each of these acts is a kind of resistance, a refusal to let emotional disconnection define one's life. The concept of emotional fluency, particularly for those with alexithymia, can be learned over time. Like any language, it requires practice. One might begin with a simple daily check-in. Where in my body do I feel tension? What color is my mood today? These exercises might seem small or silly, but they rewire the brain slowly. They help reconnect physical sensation with emotional labeling. And over time, they build a bridge from internal chaos to external expression. Therapists, clinicians, and caregivers have a profound role to play here. The best support does not come from trying to force emotion into the open, but from creating a space where it can emerge safely. This means slowing down the pace of inquiry, honoring pauses, and allowing emotions to surface in nonverbal or delayed ways. It means listening not just to what is said, but also to what is shown through routine, behavior, energy, or even silence. Peer support also plays a critical role. Autistic-led groups and lived experience mentorship are irreplaceable. There is something uniquely healing about being seen by someone who doesn't need your pain translated. Someone who says, "Yes, I felt that. No, you're not broken." These relationships form the foundation of community resilience and emotional empowerment. They offer not just support, but the possibility of emotional co-regulation, the experience of feeling more balanced simply by being with someone who understands. This means slowing down the pace of inquiry, honoring pauses, and allowing emotions to surface in nonverbal or delayed ways. It means listening not just to what is said, but also to what is shown, through routine, behavior, energy, or even silence. Peer support also plays a critical role. Autistic-led groups and lived experience mentorship are irreplaceable. There is something uniquely healing about being seen by someone who doesn't need your pain translated. Someone who says, "Yes, I felt that. No, you're not broken." These relationships form the foundation of community resilience and emotional empowerment. They offer not just support, but the possibility of emotional co-regulation, the experience of feeling more balanced simply by being with someone who understands. Families, too, need support. Parents of autistic children, siblings, partners, all must navigate a complex emotional terrain. They may grieve the life they imagined, struggle with their own feelings of helplessness, or carry guilt over unmet needs. But just as autistic individuals need validation, so do their families. When they're given tools, education, and emotional outlets, they become stronger allies. They learn that their love doesn't need to be perfect, it just needs to be present. For some, medication plays a role in managing symptoms of anhedonia or dysthymia. Antidepressants and mood stabilizers can be effective, especially when symptoms interfere with daily life. But medication is never the whole story. It is one piece in a larger mosaic of care, one that must also include therapy, routine, nutrition, sensory awareness, and above all, human connection. But just as autistic individuals need validation, so do their families. When they're given tools, education, and emotional outlets, they become stronger allies. They learn that their love doesn't need to be perfect, it just needs to be present. For some, medication plays a role in managing symptoms of anhedonia or dysthymia. Antidepressants and mood stabilizers can be effective, especially when symptoms interfere with daily life. But medication is never the whole story. It is one piece in a larger mosaic of care, one that must also include therapy, routine, nutrition, sensory awareness, and above all, human connection. In a world that prioritizes productivity and outward emotion, people who experience life from a place of emotional ambiguity or flatness often feel left behind. But the truth is, emotional depth is not measured in expressiveness. It is measured in presence, in survival, in the quiet resilience of those who keep showing up, even when their inner world feels like a void. This kind of resilience deserves recognition. It deserves celebration, because surviving in a society that misunderstands your emotional reality is hard. Living with alexithymia, anhedonia, or dysthymia is not a failure to thrive. It is thriving on different terms. It is living through the fog, the silence, the numbness, and still finding ways to care, to learn, to connect. But the truth is, emotional depth is not measured in expressiveness. It is measured in presence, in survival, in the quiet resilience of those who keep showing up, even when their inner world feels like a void. This kind of resilience deserves recognition. It deserves celebration. Because surviving in a society that misunderstands your emotional reality is hard. Living with alexithymia, anhedonia, or dysthymia is not a failure to thrive. It is thriving on different terms. It is living through the fog, the silence, the numbness, and still finding ways to care, to learn, to connect. As we look to the future, we must commit to building systems of care that are inclusive of emotional neurodiversity. Schools must teach emotional literacy that goes beyond basic happy-sad charts. Mental health clinics must adapt therapies for those who cannot easily access their feelings. Workplaces must recognize emotional exhaustion not as weakness, but as information. And communities must continue creating space for autistic voices to lead, to teach, and to shape our collective understanding of what it means to feel. Because emotion is not one size fits all. It is not a universal language, but a set of dialects, some loud, some soft, some wordless. And every dialect deserves to be heard. Schools must teach emotional literacy that goes beyond basic happy/sad charts. Mental health clinics must adapt therapies for those who cannot easily access their feelings. Workplaces must recognize emotional exhaustion not as weakness, but as information. And communities must continue creating space for autistic voices to lead, to teach, and to shape our collective understanding of what it means to feel. Because emotion is not one size fits all. It is not a universal language, but a set of dialects. Some loud, some soft, some wordless. And every dialect deserves to be heard. So if you or someone you love is navigating autism, alexithymia, anhedonia, or dysthymia, know this. Your emotional experience is valid, your pace is valid. Your silence is not emptiness. It is space, it is depth. It is the quiet edge of something meaningful waiting to be named in your own time, in your own way. Let that be the final message. You are not alone. You are not wrong. You are not broken. You are a different kind of emotional being, one with your own rhythm, your own vocabulary, your own power. And that, in itself, is something profoundly human. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling. It is the quiet edge of something meaningful waiting to be named in your own time, in your own way. Let that be the final message. You are not alone. You are not wrong. You are not broken. You are a different kind of emotional being. One with your own rhythm, your own vocabulary, your own power. And that, in itself, is something profoundly human. If you found this video helpful, don't forget to give it a thumbs up. Share it with your friends and family. And most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.